Julie Marshall from the Colorado School of Public Health, and thank you very much for your talk. I'm wondering if the thing I don't think I've heard here, but I might have missed it, is really thinking about how the data is collected on the ground, and that within communities, a lot of data is collected and passed through different systems for accountability or for surveillance or other things. But it's never tied together where it starts. And if there was more ownership at the local level, maybe there would be better granular data and use of that information. So I just wondered if you're thinking along those lines.
Yeah, I think you point out something I think is extremely important. And I think what we need to do, I mean, the idea in the past has been that public health agencies are really the focus of this, collect it, whatever, but clearly the resources really aren't there. I think it's really important that training address this, but also finding ways to bring in other expertise that is at the community level. Maybe people in community colleges, for example. I'm familiar with the system in California. Tremendous resources there that really could be, I think, brought to work on this, particularly given the technology. I think that's where the Sonoma County example here is important. It brought together the political side of Sonoma County, the technical side in terms of the dashboard and so forth, but also the public health side. And they drew on the resources from the University of California, Berkeley School of Public Health. I think you point out something that is, without a doubt, a need. Okay? And I'm thinking that it's something that will need to be addressed, but I think it needs to be addressed in a grassroots way.
Hi, Henry Montez.
Hi, Henry.
How are you doing? I'm with the Education Board of APHA to have an affiliation. But at any rate, one of the things that came to mind when you were looking toward the end of your talk about the social networks was the concept of community. And I was wondering whether or not how you're going to corral that concept, because it seems to me that concept can include populations who consider themselves a community. It can be geographic in terms of just the physical place where people are. And it can be relational in terms of how people relate with one another. So I was wondering if there was more to it, or is it mostly geographic that you're talking about?
Well, I think that's on the frontier of how to look at this. I mean, if you look at what's going on with social networks, those social networks include all of those aspects that you mentioned, from geography to people in the same profession across the country, to people across different countries. Okay? And what I think we're not doing is we're not exploiting the influence of those relationships on health. So I think geography's got a lot to do with it. Framingham is a great laboratory for that. But I think it's not the only way that we really should look at those relationships.
Hi, I'm Michael Caldwell. I'm the Commissioner of Health for Dutchess County, New York, and I'd just like to say that maybe one of the recommendations that we should make for people who are obese is that they should get an active friend. And maybe that's more important than controlling their diabetes. Maybe that will naturally help. I mean, these are just some of the ideas that are coming to mind from what you're saying. I would like to know a little more about this meeting at the NIH on June 9th. Can you tell us a little more about that? You seem to be very excited about it, and where can we get more information about it?
Okay, you can go to the Community Health Data Initiative on the web, and it will outline what's going to happen there. If for some reason you can't find it, email me and I'll send you the site. Just put June 9 in there, and I'm sure it will it'll come up. It will have people from the department, people on the data side, but the real focus is going to be on people who have been taking data of all kinds and building applications. Those applications are going to be showcased. There's going to be a session where those people can talk to one another, to people in the data. But the crucial piece that I've been emphasizing and others have been emphasizing, it's very important that people on the health side be there. People who know health problems, who can think the way you were just thinking about about not necessarily the development of new applications, but the application of the technology, who can look at what people are developing and see how it can be applied. Again, this is something the Secretary is going to kick it off. Todd Park is going to be there. And if anyone had ever said to me a few years ago that the Secretary of Health and Human Services would be so focused on data and the use of data, I never would have believed it. So I think it really is important. And if this one might not be seminal, the last one I guess was seminal, but this really is, I think, will take it another level up in terms of the sophistication of the applications that are going to be shown. There's also going to be the result of this challenge that involves student groups from around the country.
Is there going to be also incorporation of some of the health information technology discussed as well, or the newly emerging meaningful use, or anything regarding that as well?
You know, that's a very, I don't know if there's going to, if in terms of the use of that, I think that will be there. It's really hard to get away from meaningful use these days. You know, for example, one of the applications is the Blue Button application for the VA. The Blue Button application, if you go to the web and look at that, allows veterans to, in effect, push that button on the screen and have their records downloaded to them. Okay? That's built on electronic health records. The idea that this information needs to be more available for people to use, people themselves as well as others who can build on those applications. But I don't think electronic health records will be the focus. I really think it's going to be on using all that information and the focus on those applications.
Thank you.